Hospital dentistry is a service that we've provided for our patients for years now. And the reason that we do that is I have a lot of adult patients that have a terrible fear of the dentist because of a bad experience they had when they were a child. I've had a lot of adults tell me that when they went to the dentist as a kid, they weren't all the way numb or they were scared, they didn't know what was going on, and somebody held them down and made them get a filling done. And that's just a terrible experience for a child, and I wouldn't want my own child to go through that. Hospital dentistry, for the most part, we see children in the hospital, 3-year-olds, 4-year-olds, 5-year-olds, up to 9, 10 years old, even adults, anybody that is scared to have work done in the office and needs a lot of work done.
You're completely asleep. You won't remember a thing when you wake up. We don't have to get you numb. It's less traumatic when we do things in a hospital setting sometimes. And it's sometimes nice to get things done in a hospital setting if you have just a lot of stuff to get done. If you need 20 teeth fixed and you don't want to sit in our chair for 8 hours, sometimes it's nice to be asleep the whole time, to not remember it, to get it done all at once in a hospital setting.
We can make sure that they're comfortable during their appointment and they feel fine, they really don't remember anything afterwards, and they get a good experience. So sedation dentistry is one of the things that we excel at here at RiverWest and Foothills.
Hospital dentistry is ideal for somebody who doesn't tolerate treatment in an office setting. You may be really young and not able to comprehend dentistry. You may have a disability. My own daughter has a disability and she can't hold still even though she's 13 years old. So people like that are excellent candidates for hospital sedation dentistry.
My own child, when he was 5, we had his work done in the hospital because we tried to do it in the office. There's no reasoning with a 5-year-old. If he's scared and doesn't want to hold still, he's not going to hold still. And like I said, I don't want to hold a patient down and make them do anything that they don't want to do. So when we go to the hospital, the patient is completely asleep. There's no forcing them to do anything. They're asleep, they lay there. We don't have to use any shots. They don't have to get numb. We just do all of the work while they're asleep, and since they're asleep, they're not moving.
When we can provide services in a hospital setting to our patients who would benefit from it, their mental health benefits rather than just their dental health. When we can see people under sedation and they're calm, we can do an excellent job. And safety is always our biggest priority. If you can't safely be seen in a normal setting, we'll always recommend the safest place, and that may be a hospital for you.